This Pichakucha is based on Module 9, referred to as prescription drugs, and it will display how performance enhancing stimulant drugs impact American college students. My presentation will argue that easy access to prescription drugs and the pressure from increased competitiveness in society increases the rates of stimulant drug usage among college students in the United States. To start off, one of the most commonly used stimulant drugs by college students is known as Adderall. Adderall helps increase the user's output and efficiency, allowing them to finish tasks quickly and precisely. This drug is mostly used by ADHD patients who lack attention span and show impulsive behaviors. ADHD, also known as attention deficit hyperactivity disorder, contributes to low self esteem, troubled relationships, and difficulty in professional environments. Children and young adults with ADHD usually use prescribed stimulant drugs to get on an equal playing field as the rest of the society and improve their efficiency. Many sociologists question what exactly is considered normal for a child, which leads them to believe that human behavior is complex and it depends on the environment and experiences. However, a lot of college students without ADHD are utilizing these drugs for better academic results. As competition for college is getting more intense every year, many college students have no choice but to turn to prescription drugs like Adderall to increase their productivity and to stay at top among the rest of their peers. College students usually have a lot of pressure and expectations from their parents and themselves to go to a prestigious university, graduate with high scores and secure a high-paying job. With all these expectations set on them, a lot of students make use of Adderall when they are studying before exams or even during test days. According to Prescription of a New Generation by Michael Lowe, nearly one in every four college students nationwide have reported consuming stimulant drugs. These high numbers suggest that increasing social expectations placed on students to achieve success made them see Adderall as a miracle pill. Not only is Adderall a performance enhancing drug, but it also aids in weight loss. In a sociological perspective, women in college are more inclined to use Adderall due to beauty standards and expectations placed on them by society. Generally, our society fat shames overweight girls, therefore, girls want to fit into the standard so they can obtain pretty privileges. Another reason for the increase in these drugs among students is due to easy access from their doctors and other friends with prescriptions. According to Module 9 materials, doctors try to sell these drugs to their patients so they can earn more money and benefits from corporations who produce these stimulants. Some of these benefits include free lunches and speaking stipends, where doctors get paid for publicly supporting the drug. Moreover, corporations use the media to publicize these drugs and normalize the usage of prescription drugs in daily life. For example, corporations constantly portray prescription drugs in pop culture, like ads, which convinces young adults that it is completely fine to utilize these drugs for their own benefits. Corporations only care about profits, therefore, they take advantage of college students who are constantly pressured in our sexist based society. Even though Adderall has so many benefits for its user, it also has a lot of side effects as well. According to American Addiction Center.org, Adderall can lead to nervousness, restlessness, and anxiety that impacts sleep patterns. In addition, it can cause tremors that cause shaking of various body parts. Not only that, but a lot of students develop eating disorders while they're on Adderall, since the medication makes a person feel full and increases their metabolism, so they burn even more calories than they usually do. Even if prescription drugs are normalized in our current society, it causes a lot of harm to the bodies of young adults, eventually as they grow older. Adderall has a high risk for addiction and abuse. Many who take this drug slowly become dependent on it, which makes it harder to live without Adderall. To prove this point, my secondary source, AmericanAddictionCenters.org, states that the largest age range of people who are abusing stimulant drugs without a prescription or a medical need are 18 to 25-year-old young adults. Since Adderall helps them produce the best results possible, college students tend to abuse this drug to reach the expectations implanted on them by society. Usually, these drugs are illegally obtained from friends, family, or internet pharmacies, but this behavior is generally acceptable because the student is able to perform well. About 74% of students get their Adderall from friends who have prescriptions. Students prescribed with stimulant drugs sell them to other students in hopes of earning more money. Some ways to reverse this social crisis is by placing more effort in getting patients off of drugs than on them, and try to create a medication free life for children. In addition, raise awareness regarding the side effects of these drugs and utilize the idea of decriminalization and legalization of prescription drugs. In short, this picture Kucha displays the social reasons that cause students to turn towards prescription drugs. And some of those main reasons are easy access to drugs from doctors and pressure from social expectations.